Well, it's my pleasure to have a couple of gentlemen, a couple of doctors from MemorialCare Saddleback Medical Center. And I'd like to welcome Dr. Jeffrey Altschuler here. He's the Medical Director of Cardiovascular Surgery at MemorialCare Heart and Vascular Institute at Saddleback Medical Center. Welcome, Doctor.
Thank you.
And we'd also like to welcome Dr. Mark Sakwa, and you are the Chief of Cardiovascular Surgery over there at MemorialCare Heart and Vascular Institute. Welcome.
Thank you.
To both of you.
Thank you very much.
And you were just telling me just a couple minutes ago that you're both new to the area, am I right?
Correct. Just moved out here a month ago. We've worked together for 30 years and decided it was time for a change in a career and a nice opportunity.
Where are you from?
The Detroit area.
Okay, both of you.
Both
Yeah.
of us.
All right. So, welcome to our nice weather. Although, as I was saying, we could use a little bit more rain, but quite different from that area. And it's great to have you out here.
Thank you.
So, what made you choose to come to this area, and particularly MemorialCare Saddleback Medical Center?
We were fortunate to have an opportunity to hear about a position that had opened up with MemorialCare. They were looking for heart surgeons to run multiple hospitals, but particularly here at Saddleback. We had been together for 30 years, thought we had one new adventure in us, and decided this was a great place to venture to.
Yeah, and I see that, at least for you, I don't know for you, Doctor, but you also are at Long Beach.
Yes.
And that's, of course, part of MemorialCare as well, a Long Beach Medical Center. So, we all hear about different types of heart diseases, and I think even to this day, for some people, it can be a little confusing what that means. So I'll ask you first, if you don't mind me calling you Jeff.
No problem.
Tell us about heart diseases, the types, and
Well, kind of break it down, the three types of diseases we treat are coronary artery disease, blockages that cause heart attacks that typically patients will have stents for or bypass surgery. Then there's valvular disease, where the valves are either stenotic, getting too tight, or leaking too much, in which there's a couple of ways of treating that surgically and with catheters. We fix the valves, repair the valves. Kind of in that area, and I can let Mark talk about that a little bit more too, is we've evolved from going through the breastbone to making a small incision and replacing the valves that way. And then kind of the third area is the blood vessels from the heart in the chest. When people get aneurysms, dissections, and treating those a lot of times now without surgery with catheters and kind of relining the arteries from the inside.
So, Mark, over the years, probably over the last 20 years especially, we have seen so much advances, particularly in minimally invasive surgeries, if I said that right.
That's great.
In fact, many years ago, I was at a company up in the Bay Area, not that I'm a doctor of any means, but it was a company called Heartport at the time that developed one of the first mechanisms to go up through your leg and that sort of thing. And that was such new technology, but nowadays, that's how a lot of it is done, right?
Well, I won't say a lot of it is done, but it's certainly we've embraced that technology. It's interesting you mentioned Heartport, because that was kind of like the initial groundbreaking for these minimally invasive valve procedures. And now we've used, even still today, use some of that technology in performing these procedures. One of the things that Jeff and I are sort of known for, and what we've kind of embraced, are minimally invasive approaches to heart surgery. We'd like to look at the patient realizing that they have, a serious problem, but we'd like to treat it in the least invasive way for them, because that promotes early recovery. They get back to playing golf quicker. They get back to doing their activities quicker. And I think this community likes golf, so
yes, they do.
We can get them back
and
to doing
activities
those things.
in general, they do.
So that's one of the things that we have embraced. So we can do our valve replacements through tiny incisions in the chest wall without opening the breastbone. Or if they're not a candidate for that procedure, we can now mount those valves on a catheter and go up through the groin and place a valve inside their native valve.
Yeah, that's amazing.
It's incredible.
Yeah, and that's what, 20 years ago, what I first heard about, and I was just amazed by that. It was a couple doctors from Stanford University.
That's right.
Yeah, very interesting. Let's talk about heart disease in general. And I think a lot of people probably understand some of the risk factors, smoking and for a lot of people, maybe being overweight and, not enough activity and that sort of thing. Is that still the basics of heart disease, along with what about something that runs your family, hereditary?
Probably the most important thing is the family. Picking the right parents. But everybody knows, you don't smoke, you exercise, and it doesn't mean you have to go out and run a marathon three times a week. It just be active, walking, physically engaged. Again, I said smoking, controlling blood pressure, diabetes. So that really has not changed much in the last years.
I would add that, as Jeff said, if you have the genes and you're predisposed to heart disease, then by living the proper lifestyle, if you will, with good diet and exercise, will at least delay the onset of some of these potential symptoms that come with the heart disease. The other thing that's been fascinating is the drugs to lower cholesterol and lipids in your body. They work.
They do.
And so people who have high cholesterol and get on these drugs, they will really slow down the progression of their coronary artery disease.
What about screenings in general, the type that are available? And I guess what I want to ask along that is, I think to this day you go to your primary, and for most people, they're there for a fairly short amount of time. Let's say their annual checkup. They're fairly healthy people, and they check your blood pressure and that sort of thing. Are we at the point, though, once you get to a certain age, that you need more annual or biannual screenings that can really look at sort of the mapping in your body of the major arteries and vascular system, where they can see, hey, you have a blockage here, or maybe you don't, that's not showing up by just, checking your cholesterol?
I think the screenings are good. A lot of times, again, particularly women, don't have typical symptoms of heart disease. People always think heart attacks, you can picture, this is the big one, squeezing chest, but there's a lot of subtle symptoms that people say, I don't have heart problems because I don't have the classic symptoms, and I think screening can uncover a lot of those issues before they become major issues.
Okay, and is that really on the primary, your primary doctor, where, again, they're going to check your blood pressure, and then maybe once a year they draw blood and look at your cholesterol level? Is that going to tell them enough?
It may not. As Jeff said, some of the symptoms are very subtle. Nowadays, there's less invasive ways, if you will, to actually test for coronary artery disease. As you get older, and if you have a strong family history, certainly stress tests still give quite a bit of information. I think people should have stress tests. Can you explain that, a stress test? So a stress test is when you stress the individual either on a treadmill or on a bicycle, and you give it what we call thallium, sort of a radioactive material that can show whether or not the heart is getting enough blood supply in certain areas. So if you have a blockage, you can see whether or not there is an area that's not getting enough blood supply, which can lead to some type of intervention if necessary to prevent the heart attack. As well, nowadays we can use CAT scans to evaluate the coronary arteries. We can measure the amount of calcium in the arteries, so called the calcium score. Or we can actually get really good pictures now of the arteries just with a CAT scan and some dye to see whether or not there's blockages. And we can even take a measurement with within that artery to see how narrow it actually is.
Okay, so is that something that, again, you get checked, you talk to your primary care about your history, and the first level is maybe that stress test, and then from there, they might go more to the screenings?
Yes, I think that's probably the way it is right now, but probably in the future, that CAT scan may become first line.
Yeah, which I think would be great. I have two, I'm lucky here, I have two heart surgeons here, so I'm going to ask a question about the wearable devices we have right now that often can detect maybe a problem, EKG and that sort of things. And there's been a lot of talk about how they've helped a lot of people, how reliable they are. Jeff, what's your opinion on those?
I think they're great, give great insight into patients' symptoms. A lot of times a patient trying to relate a symptom to a physician is hard. And the physician's trying to decide what's really going on. If you have some objective measurements of irregular heartbeats, change in heartbeats to correlate, that provides a lot of insight into the patient's, what's going on with the patient.
Yeah, that's good to know. Another question I have that people have heard of over the years is, and I've heard that it's changed, is salt in your diet, high sodium levels. And I don't know how many years ago it was, maybe 5 years ago, the CDC actually raised that level from what it was, what they thought was good, and then they go, no, we think you can be up to this level. How do you look at that as far as sodium levels?
So there's a condition called congestive heart failure
Right.
that is more prevalent in our society than people realize. In fact, it's kind of a new frontier as to what we're looking at
Okay.
and trying to get early intervention and treat. People who have congestive heart failure may have had coronary artery disease in a previous heart attack or valvular heart
Okay.
disease where there's some damage to the heart muscle. In those patients, if they eat a lot of salt, they will retain a lot of fluid and they will exacerbate their congestive heart
okay.
failure.
All right.
But if you don't have a lot of heart failure, I'm not sure that I think salt is as important,
Okay.
except in that group.
Okay, of course, you don't want to overdo it on anything.
And I
but,
think
yeah.
the important thing about salt is you need salt in your diet.
Yes.
Where people get tripped up in their diet is they say, well, I don't take the salt shaker and do this. Processed foods is the
Right.
killer for salt.
Yeah.
You have to read a label and see how much sodium is in those products.
Right.
That's
And
what
I
you
always
eat.
say, tell people, why is it when you go out and you have that meal at that nice restaurant, why does it taste so good? Well, there's two factors they use: a lot of salt and a lot of butter.
Right.
So, on that same line, are there heart-healthy foods? Over the years, again, you hear about oatmeal and things like that. Is that true? I mean, can people obviously cut down on the things we should cut down on, but by having more leafy greens and oatmeal and those kinds of things, is that a help?
I think everybody, you need fat in your diet, you need
Yeah.
protein in your diet, you need carbohydrate in your diet. The trick is knowing what's the good fats, what's
Yeah.
the bad fats, what's good carbohydrates, what's bad carbohydrates, what provides fiber, what's good proteins, what's not good proteins. So it's eating a smart diet, not a fad diet.
Yeah, see, I like this guy. All right, let's talk about treatments for people who have heart disease. Again, it's going to be different at what level that they are, but still, what can people do?
So if you have coronary artery disease, nowadays, certainly there's great medical treatment for it. But if you fail the medical treatment, the disease progresses. There's obviously opportunities to treat that with stents, which is like a coil that opens
Yeah,
up inside
yeah.
the artery to take away the blockage. And there's still bypass surgery, which is still the staple of what we do as heart surgeons. Bringing it to the next level is valvular heart disease. Nowadays, treating that can be done, as we mentioned, minimally invasive surgically or sometimes with a catheter. And then aortic aneurysm disease, why don't you tell them what you do for that?
Well, the thoracic aorta is the main artery of the heart, and probably the most devastating disease we see that is called an aortic dissection, where the artery starts to tear. And a lot of times now, we treat that again with catheters and relining the artery from the inside. 15, 20 years ago, treating that surgically was just a massive, massive operation with 6-8 months of recovery before you felt normal. So it was quite an advance to be able to do a procedure where the patient is out of the hospital in 2 days with a needle stick in their groin and no big incision on their chest.
Yeah, that is amazing. The advances is just tremendous. I want to tell folks about a great sort of a seminar event that will be happening on Thursday, February 27th, and it's going to be called the Minimally Invasive Approaches to Cardiac Diseases over at Saddleback Medical Center. And the program, they're going to have screenings going from 4:30 to 6:30. Those will be by appointment. And then the program will be 6:30 to 8. Dinner will be provided, I assume, a nice healthy dinner, right?
I hope so.
And if you'd like to find out more information on that or schedule a time, especially for these screenings, I think this is fantastic. Please give them a call. It's 800 Memorial 636 6742. And the website is memorialcare.org/SB classes. And you both will be over there?
Yes.
Yeah, that's fantastic. Great to meet you. Detroit's loss is our gain.
Oh, that's
Thank
nice.
you.
Thank you.
It's great to have you here.
Nice to meet you.
Thank you very much,
Thank you so
doctors.
much.
Hope to see you both again. This has been a fun conversation and
You're
very,
not over there.
yeah, not over there. Well, maybe for this event, but
Right,
not, yeah. All right, we'll see you next time. We'll be right back.